Tánaiste, over the last few months we've seen a situation where the nursing organisations have expressed great concern at the increase in the retention fee by the nursing board from €100 to €150. This has been ongoing for some time. It has been highlighted, as I said, by political parties, by the advocacy groups, patient groups, the nursing organisations themselves, that a 50% increase in any fee is an extraordinary amount of money to demand. Coupled with the fact that this is a mandatory situation, this is a registration board, and under law, nurses have to register with this board. So there is no choice. If a nurse wants to practice in this country, they have to register with this particular board. And no reasoning or rationale other than the fact that they say they have to continue with significant changes in the fitness to practice area, which includes the introduction of new preliminary proceedings committee, and that needs to upgrade its systems as continuing professional development will become a mandatory requirement for nurses and midwives. That's the board's only reasoning for increasing the registration fee from €100 to €150. Now, Minister, we all know that people on frontline services are under extraordinary pressure. They are delivering health care to the people that avail of our health services. But the very least that should happen is there should be engagement between the board and the organisations representing the nurses to ensure that we have a registration system that's fair, that's professional, but that's also affordable. And the idea that any fee could be increased by 50% without rationale is something that's unacceptable. And finally, Minister, our straight-talking Minister for Health, who claims that he is the person that says it as he sees it, well, on this occasion, he wrote to the board asking them to engage with the nursing organisations. And there's been no either activity from the Minister himself or from the board in trying to provide engagement. So will you at least take up the cudgel for the nursing organisations and ask the board to engage in a meaningful way with the nursing organisations?
Thank you, Deputy. Tánaiste.
Thank you, Deputy Kelleher. On the 17th of September, the Board of the Nursing and the Midwifery Board of Ireland, they voted to increase the annual registration fee for nurses and midwives from €100 for each new registrant in 2014 to €150 for 2015. And as you rightly say, that is a very large increase at a time when, as we know, the problem is not inflation in the Eurozone, it's the risk of deflation. So it is a very high increase, I agree with you. The staff associations have undertaken a campaign not to pay the new fee and have advised the members of their organisations to pay the old fee of €100. Nurses who do not pay the appropriate fee will be potentially removed from the register. Now, as you said yourself, what this actually needs is negotiation, discussion, consultation, so that an agreement can be reached. And I myself personally would know and have met and spoken with nurses who do find this a very significant increase in a situation where a lot of them are facing stretched budgets. So in relation to the Department of Health, they have written to and met with the President of the Nursing and Midwifery Board on a number of occasions. There were 2 meetings in December of 2014. Expressing concern about the possible implications for the health services and patient safety if this should lead to some form of industrial dispute which might then impact on patients. The board of the NMBI, they met the staff associations and the matter was discussed at board meetings, but I am conscious that it hasn't yet been satisfactorily resolved. The Minister for Health continues to monitor the situation closely, and he has asked the board and the staff associations to continue these discussions. But there isn't a satisfactory outcome as yet, Deputy, that I can report to you.
Thank you. Deputy Billy Kelleher.
See, Minister, that's the problem. The Minister for Health just monitors. I mean, that seems to be his forte at this particular time. He monitors waiting lists, he monitors trolley counts, but we need a bit of activity in this particular area as well. And we don't need the Minister to monitor anymore. What we need is the Minister to ensure that the board engages with the nursing organisations to ensure that we have an affordable retention fee so our nurses can engage, that they can register and that they're allowed practice in our public health system. And they are threatening to pay just the previous registration fee of €100. And if they do, well then we have a situation where our nurses will no longer be employed by the health services. And that's the situation we're facing. Now, it would be very easy, I would suggest, for the Minister to ensure that there was positive engagement between the board, which has unilaterally just decided to increase the fee by 50%, without any real meaningful need to do so, other than a bland statement saying that they have to do this for fitness to practice reasons. I mean, moving buildings from Fitzwilliam out to Blackrock, is it the way that this nursing board got caught up in the property bubble itself? But the bottom line is we can't expect nurses that are already under pressure financially, as has been highlighted by many reports, that they now are forced mandatorily to have to pay an increase of 50% on the registration fee. This is not a choice. If they want to work, they have to pay this. It is a form of tax. Let's be quite clear. There's nothing voluntarily about this. They have to pay it. So I would suggest that you would ask your constituency colleague, your cabinet colleague, to roll up his sleeves and ask the board to meaningfully engage over the weekend in terms of bringing this to a satisfactory conclusion.
Thank you, Tánaiste.
Well, the history of having registration bodies for different groups of professional workers is one which, by and large, as you're probably aware, all of the professional groups have welcomed. And in fact, this has been debated from time to time, as you know, in the House here, both in this Dáil and in previous Dáils, and people have been very positive towards it. We can think of teacher registration, we can think of registration in relation to professionals who work in the social work area, and similarly, because nursing in Ireland is a graduate profession with a huge amount of training and investment by the state and by the individuals in their education and their training. I think that there is a strong underlying support for the principle of professional registration. But when the professional registration structures were set up, it was made clear that the board would be independent and it would deal with the professional practice and the safeguarding of the professional practice of people, of nurses, which obviously has an enormous impact on patient health, safety and the delivery of services. You're talking about the board themselves perhaps having had some difficulties, but following discussions with the Department of Health in 2013, it was agreed that a one-off sum of 1.6 million would be granted by the Department to cover 2013-2014 costs, on the basis that the board would have to review its overheads and increase its income in 2015 to meet its commitments under the legislation. So the board has actually been very significantly assisted by the Department of Health and by the government to meet whatever type of financial situation you're referring to. But at this point, the only way that this will actually be resolved is by further discussions between the parties to sit down and actually resolve the issue. And for the nurses who are working in our health services, or indeed who travel abroad to work in other health services, it is important that the registration fee would be fair and that this issue, this dispute, is resolved as soon as possible.
Thank you, Tánaiste.